I turn it over to our colleague Mary Waters from Harvard, who will talk about folks in the diaspora, the pandemic, and the children of immigrants. Mary, thank you.
Okay. Well, thank you very much, Carilla, and thank you, Marcelo and Professor Zamani and the Academy for having me here. I'm very honored to be presenting here today. So we could start the PowerPoint. Yes, okay. I'm going to talk today about the children of immigrants, primarily in the United States, but also in the European Union, and how they have experienced the pandemic. And I think there are some through points with the previous speakers in terms of the differential impact on people at the bottom of the social hierarchies, and also about the erosion of social trust that has, I think, characterized many of our societies, and the ways in which children really suffer from that lack of inclusion. So just to begin with, immigrants are our future. As European and American native-born populations age and our fertility rates go down, children are much more diverse and much more represented by immigration. In the US, there are 45 million immigrants. It's about 14% of the population. Another 38 million people are native-born with at least one immigrant parent, the second generation. And so together, these are more than 26% of the population. So in the US, 1 in 4 children are the child of an immigrant, 18 million children. So in the European Union, 5% of the total population are non-EU citizens, 8% were born outside the EU. In other countries in Europe, they have very high percentages of immigrants. In Iceland, it's 1 out of 5, Norway 15%, UK 14%, in the Ukraine it's 11%. So immigrants are a very large proportion of our society, and in the pandemic there was not really explicit planning or outreach to immigrants, and this was a big problem. In terms of thinking about the impact of the pandemic on the children of immigrants, we're at the really beginning of gathering data and analyzing this subject. We do know that immigrants are on the front lines. They're at in low-wage work, and so they were differentially impacted by the pandemic. Health and mortality data generally are collected by race and ethnicity in the United States, by sex, by age, not so much by nativity. So it's difficult sometimes to tease out immigrant-specific rates. But what we do know are that the estimates that we have for COVID deaths and sickness are absolutely underestimates. That, and as we're looking now at excess mortality each year, we see that COVID had a much larger impact on our societies. There were many, many COVID deaths and illnesses that were not coded as COVID. So the impact is even much higher. So why are children of immigrants or children in immigrant families at risk? First, they are generally from racial and ethnic backgrounds that are different than the white majority societies that they have immigrated into. Secondly, the parents in immigrant families work in occupations which were at very high risk for getting COVID early in the pandemic. Immigrants tend to live in intergenerational households, and so when immigrant parents worked in places where they were more likely to get sick, that meant that grandparents who were living in the household got sick and were at higher risk of mortality. Documentation status has made a very big impact on how people experience the pandemic, both in terms of cutting people off from insurance, but also keeping people from seeking help when they were sick because of fear of the authorities, fear of being caught if they should seek medical care. The other thing is that families were isolated. The borders were closed immediately once the pandemic occurred, and even if people had the ability to, because they had documentation status, the ability to go back home or to reunite with their family members, this was stopped because the borders were closed, and so people were left without extended kin to help them through the pandemic. So what we do know are that parents and grandparents were at great risk because of their characteristics. And we know that then children of immigrants, we talked about the growth of people who had lost caregivers, the growth of people who were orphaned by the pandemic. Children of immigrants are much higher risk than children of natives for a parent death or a grandparent death and serious illness. And in countries where we do have some data available by nativity, immigrants had much higher rates of positivity of COVID cases. So in Sweden, 32% of those testing positive were immigrants in the first year. In Norway, 42%. In the province of Ottawa in Canada, 44%. In Italy, immigrants were more likely to be diagnosed late, hospitalized, and admitted to an ICU. So in the US, where we don't have nativity data, we do have data by race and ethnicity. Latinos had much higher rates of getting COVID, of being hospitalized, and of dying from COVID. In the state of Minnesota, researchers were able to find nativity data on race, on deaths from COVID. And immigrants had twice the mortality rate of natives. And much more to the point of how it impacted children, the immigrants who died were mostly working-aged men. So children were at risk of losing their fathers. And so this is just a figure that looks at the black bars are the foreign-born and the white bars are the native-born. And what we know is that immigrants are concentrated in the working ages. If you look at all COVID mortality, it's very high among the people over age 80. But if you look specifically at the mortality of Latinos and Blacks and Asians, you find that it skews to the left. It is the people who are dying are dying young and leaving behind children. So 120,000 children in the US lost a primary caregiver, either a parent or grandparent who took care of them. Another 22,000 lost a secondary caregiver, a grandparent who was primarily giving them, taking care of them. Hispanic children were much more likely than whites to lose a caregiver, and as were Blacks and Asians. And the highest rates of losing a caregiver were among Hispanic kids at the border. As I said before, these are all underestimates because they're based on diagnosed COVID cases and not on excess mortality, which is much higher. So immigrants were very much on the front lines, are still very much on the front lines. They are very, in both Europe and the US, they're concentrated in healthcare and in the low-paid jobs in healthcare, taking care of the elderly, taking care of people in hospitals. They're also overrepresented in places that didn't shut down when all of us were working from home. They work in agriculture, they work in meat packing, they work in service industries. They were also much more at risk of losing their job and losing hours, and so they lost a lot of income. The U.S. responded very quickly with a couple of massive aid programs to families and to individuals in the U.S. And these were very cruelly designed to exclude not only undocumented immigrants, but anyone who lived with an undocumented immigrant. So the CARES Act and the other acts that that gave unemployment aid, that gave aid for people to avoid eviction, and that increased food stamp aid, all of them were designed so that if you didn't have a Social Security number, if anyone in your household didn't have a Social Security number, you could not get the aid. So citizen children who were entitled to this aid were denied it because they were not included because of this rule. And it was very cynically designed this way. The other very cruel coincidence was that in February, right before the lockdown, the Trump administration instituted what's called they tried to institute what's called the public charge rule, which was to say that any immigrant, even if you were legal immigrant, even if you were a citizen, if you had used any government aid, including going to the emergency room and getting Medicaid or asking for food aid, you would not be allowed to become a permanent resident. And we were in the field doing research with Latino immigrants during this period and then in the pandemic. And even though there were a lot of court suits against this, it was never really instituted. And even though it wouldn't have had the worst effects that people thought it would, the idea of the public charge rule became known across the immigrant community, and people were terrified, actually, of getting any food aid for their children, terrified of going to the hospital, because they thought it would prevent them from ever being able to sponsor anyone to come to the US and prevent them from becoming permanent residents. As a result, there was a real rise in food insecurity among immigrant families, at the same time that churches and food pantries were closed down because of the pandemic rule. So there was a really large rise in hunger among immigrant families. And surveys have documented this. 41% of poor immigrant families in December 2020 reported food insecurity in the past year. 43% anticipated it in the next month. So we know that there are going to be long-term effects of this on children's health, physical health, and of course, their emotional health. We've talked a lot in this conference already about the interruption of education for children, and I think immigrant children experienced all of the problems that all children globally experienced with the loss of schooling. But I think especially online schooling was more difficult for immigrant children because their parents don't know the school system, don't know the curriculum, and in many cases don't know the language. So the kids were really on their own. Also, the parents were working outside their homes, and sometimes there were not people available to help watch the children. A lot of kids were left on their own. And the other really important part that I want to stress is that immigrant kids are integrating into the United States. They're becoming Americans. And where that happens very much is in schools. So the interruption of schooling interrupted integration. It interrupted their ability to learn the language, to make friends, to learn the norms of the society. It cut them off from this process of integration, which we know occurs pretty rapidly for kids. And so this was another added issue for immigrant children. Pandemics historically have always led to scapegoating and prejudice. Jews were blamed in the Middle Ages for the plague. Throughout American history, we have excluded immigrants based on the idea that they're bringing in diseases. And this came about very quickly in the US. So Republican governors in Texas and Florida blamed Latino immigrants for rising cases. Politicians like Trump exacerbated the fears that people had by blaming Chinese people for the pandemic, calling it the Chinese flu and the Kung flu. And anti-Asian prejudice and hate crimes soared during the pandemic, creating fear among immigrants and their children. So the average, this is an organization that's tracked anti-Asian hate crimes, and the average up until 2019 was that there were around eight reported per year, and it increased tenfold to 81.5 anti-Asian attacks. This, there were several murders that got a lot of news attention. So I don't want to leave you with the impression that immigrant children are only victims from the pandemic. In many ways, I think that they can be models of the resilience and ingenuity that they bring to American society. A lot of work, including Carola and Marcelo's and my own on the children of immigrants, points to their resiliency, to their cultural creativity, their ability to react to new circumstances, to create new cultural ways of dealing with things that is very much a model for what all of us were forced to do in the last 2 years. That circumstances changed quickly. We had to develop new norms about when we put on a mask and when we took it off, and new ways of dealing with the world. And immigrant children have done that. Immigrant parents have done that. And so there's ways in which I think that they were ahead of us in terms of understanding how to deal with these new circumstances that we now live in. The pandemic, and a number of people have talked about this through this conference, provides a window for both negative change and positive change. And two that I want to point out that happened in the last 2 years was that there was a change to our policies about immigrants and detention, and I also want to talk about the child allowance and child poverty. So detention centers and border camps where immigrants are detained. We currently have a Remain in Mexico program where people who are trying to come into the US are forced to remain in tent cities on the Mexican side of the border. We also have a lot of undocumented immigrants that have been kept in detention centers, and all of these places were places where COVID ran rampant, where people were together and there was no way to socially distance. So the rates of COVID were quite high in these detention centers. And by December, cases were 3 times higher than in the general population. The EU reported very high rates in their migrant welcome centers and detention centers. So what happened was these governments decided, well, we could let people out. So they, the number of people in detention had reached its peak of 55,000 people per day in the US. And by the spring of 2021, it was down to 14,000 people. And this is because they provided alternatives to detention. They gave people ankle bracelets. They just released them and gave them court dates. In Europe, 2 writers describe it as the short summer of abolition. There were declines in detention in Germany, Belgium, Italy, the Netherlands, and Sweden. Spain closed all their facilities and declared a moratorium on detention. The UK reduced its detention numbers by 70%. So here's the US, and you can see this, these statistics start in 2001. We're at, by 2021, we're at a lower rate than we had since before 2001. There are only 14,000 people in detention. You can see the increase there. This is the same data. You can see the increase under the Trump administration and then this precipitous drop. So what this proves, of course, is that we didn't need to be keeping these people in detention, right? They were not a risk to our society. They were parents, they were children who were being kept in prisons, right? And so this shows that when the society decides to, we could just end detention. It's going back up again, but we realized that we could stop. So the child allowance is another example. Very, very quickly, the child allowance was instituted in the United States, over $3,000 per family if you had children in these ages. The checks just appeared in people's bank accounts because they had filed their income tax. It was flawlessly done. It was quick, and the undocumented were once again excluded. But what this did was it cut child poverty between a third and a half. The effects were remarkable. It was easy. And we also once again proved that when we had a will, we could do this. We could end detention and we could lift people out of poverty. Unfortunately, the detention numbers are rising again, and the child allowance was not renewed, and child poverty is going back up again starting in January. So it's a missed opportunity, but it is an example that we can do things better. Immigration is likely to rebound and be even higher, and of course, the Ukraine war is creating refugees as we sit here. People are walking miles and miles across borders. The planning for the next pandemic has got to explicitly include immigrants. We have to do better in terms of thinking about them as our population, because immigrants and their children are our collective future, and they are us, and we are them, and we cannot treat them as any less, which is what we have done throughout this pandemic. So, thank you very much.